kids are aborted in the U.S. alone. Worldwide, 57,090 are killed. Abortion is a deliberate termination of a human pregnancy. Most often is performed during the first 28 weeks of pregnancy. Abortion is described as the explosion of the products of conception before the child is viable. Some of the excuses used are they don't feel mature enough to raise a child, they're not ready for another child, they can't afford a child, they don't want to be a single mother, it'll interfere with education or career, the husband or partner or parent wanted them to abort their child, and they don't want people to know that they had sex or even got pregnant. Two of the main excuses used are physical problems with the health of the mother or child, or they were a rape victim. There's two types of abortion. Some of the ones of chemical abortion is the mifepristone. This drug interferes with the levels of progesterone, a hormone that keeps the fetus implanted in the wall of the uterus. And a most common one is the morning after pill. A woman is administered large doses of birth control that prevents the embryo from implanting itself into the uterus wall. 12 hours after the first dose, a second dose is given. Surgical abortion. One way is a manual vacuum aspiration. Dilators, or metal rods, are used to stretch the cervical muscle until the opening is wide enough for the abortion instrument to pass through the uterus. Then a handheld syringe is inserted into a tube, which is then inserted into the uterus. The fetus is then suctioned out. D&C, or dilation and curettage. After the cervix is dilated, a suction device is placed in the uterine cavity to remove the fetus and placenta. Then the abortionist inserts a cervitet, a loop-shaped knife, into the uterus. The abortionist uses the cervitet to scrape any remaining fetal parts out of the mother's uterus. A saline solution is used with a long needle which is inserted in the woman's abdomen directly into the atomic sac. In a saline abortion, anatomic fluid is removed from the woman and replaced with a strong saline solution or a salt solution. As the fetus's lungs absorbs the salt solution, it begins to suffocate. The saline solution also burns off the fetus's outer layer of skin. Hysterotomy. This procedure is the same as a C-section, except that in a hysterotomy, no medical attention is given to the baby. Most often, a wet towel is placed over the baby's face so it can't breathe. Sometimes the baby is also placed in a bucket of water. The goal is to make sure the baby doesn't survive. How the mother can be affected is with physical complications. Some of the short terms are cervical lacerations and injury, bleeding, hemorrhaging, serious infection, and incomplete abortion. Some long-term are future preterm birth, placenta previa, and some physical complications are major depression, anxiety disorder, suicidal behaviors, substance dependence, and in some cases, the mother dies. Ways to prevent abortion is to make contraceptions easily available to everyone. Give young people a better teacher than experience. Create new birth control methods. And make abortion illegal. So let's help save lives and stop killing innocent children and help them grow.